Mario Elia. Today we'll be joined by Dr. Faisal Rehman. He is a nephrologist at LHSC, and he'll be talking to us about kidney health, how to keep your kidneys healthy, what to avoid, and some advice around medications around the kidney. And we'll be finishing off the conversation with Dr. Rehman to talk a little bit about an interest of his in combat sports. And he has a bit of an interesting story that he'll share with us. So we'll be right back after this message. Welcome back. Again, I'm really pleased to be joined today by Dr. Faisal Rehman. He is a nephrologist at LHSC, and will be talking to us today about kidney disease. So thanks for joining us, Dr. Rehman.
Thank you so much for having me here. It's great to be on.
So I have to sing his praises. So I think it's fair to say that to say you're beloved among medical students is an understatement. You've been honorary class president for how many medical school classes now at this point?
You know what?
It was on the spot here.
2011, 2014, 2017, and 2020.
Perfect. So for those at home, every medical school class, of all the instructors, physicians that come and lecture and provide guidance to them, they are able to select one physician, again, think about how many physicians work at the university, to be their honorary class president. So again, Dr. Rehman's been honorary class president for many, so beloved and informally known as the King. King Rehman is his nickname. So we'll jump right into it. So again, he's a nephrologist. One question I guess we'll clarify, because some patients are obviously confused by this: the difference between a nephrologist and a urologist. So talk about that distinction to start.
It's an important one, because I refer to myself to my patients as I'm your kidney doctor, when really there are quite a few differences between urologists and nephrologists, both of whom can be considered kidney doctors. Nephrologists do the medical management of patients who have kidney disease. So kidney damage from medical issues like diabetes, autoimmune diseases, drugs and such. And we try and stabilize the kidney function medically in patients who have kidney disease, and really try and prevent them from progressing to dialysis, which is a machine that cleans the blood for the patient when the kidneys no longer work. And then once patients are on dialysis, we also take care of those patients. And then after they get their kidney transplant, we take care of the medical management of that. Urologists do everything surgical. So if you have kidney stones that need to be removed, you see a urologist. If you have a kidney cancer that needs to be removed, you see a urologist. If your prostate's getting too big and blocking your urine from passing out of your bladder, you get a urologist. So the urologists, and they tend to also, many of them do the kidney transplants. So they're the surgeons, and we kind of do the medical management of kidney disease.
So let's talk a bit about kind of basic kidney health. So starting with the basics. So if someone were to ask you, what do the kidneys do? What would be your answer to that?
The kidneys are complicated, but in the most important function of the kidneys is to preserve health by making sure that we are able to excrete or get rid of toxins from our body in our urine. And the kidney's primary function is to form urine. And so when people ask, well, what can I do to keep my kidneys healthy? Really, what the same things you do to keep your whole body healthy. So stay fit, exercise, make sure you get your blood pressure checked when you see your family doctor. And if it's high, have it treated, because high blood pressure can damage the kidneys. If you are prone to diabetes, you have risk factors for high sugars, make sure you have that checked once in a while to make sure that, because diabetes is the number one cause of kidney damage over time. So really, physical fitness, healthy diet, our healthy living, avoiding smoking, don't drink too much alcohol, all of those things will preserve your general health and also will preserve your kidney health. So that's really key. The second thing is the kidney does do some other cool things, like it makes some hormones that help you activate vitamin D. It helps you make blood by making a hormone called erythropoietin. And so it's important to keep your blood level up and prevent you from becoming anemic. So the kidneys have other cool functions as well. But I think the most common one that people think of is the ability to get rid of poisons from the body.
So you gave us a few interesting points about how to keep our kidneys healthy. Now, for patients who are wondering about what their actual kidney health is, any guidance on what they should be asking their doctor for, how often they should be getting testing for?
I think if you are healthy and fit, when you see your family doctor for your annual physical, at some point, between the ages of 20 and 40, you should get a set of blood work done. Just a baseline set of blood work, which can include looking at your red blood cells, your white blood cells, your platelets, as well as a special test, a simple blood test to look at your kidney function and perhaps a urinalysis. And then if those are normal, you probably only need to get it checked honestly, every 5 to 10 years. I think once you hit the age of 40, you probably should get a full set of blood work done no matter what by your family doc. And then depending on your risk factors, you will need to have your blood work, including your kidney function, monitored on a regular basis. It could be once a year, it could be once every 2 years. What are those risk factors? Well, even things like being obese, having type 2 diabetes, having high blood pressure, having a family history of kidney disease. These are all sort of risk factors that will make you want to check the kidney function more often. The other group that I worry about is if you have a chronic inflammatory condition like rheumatoid arthritis or anything like that, where you're needing anti-inflammatories like ibuprofen or Aleve or other these over-the-counter anti-inflammatories, they can damage the kidney. So if you're requiring those, you probably should have had for your kidney function checked at least once a year to make sure that they're not causing damage.
And you mentioned anti-inflammatories. This is something we struggle with in family practice. Given that patients can get it over the counter, get anti-inflammatories, ibuprofen, naproxen over the counter. Sometimes we know, sometimes we don't know, and we know it can cause kidney damage in some patients. But what advice do you give to patients in terms of taking it? What are their risks? How concerned do they need to be about the effect on their kidneys?
So it's a great question. I'm very biased because I only see patients with kidney disease.
Yeah.
So if you have kidney disease, I try to have zero tolerance for anti-inflammatories. Like I tell them, never take them again. And I will use other medicines at my disposal to try and get their pain under control. But, there are situations where patients have unremitting rheumatoid arthritis, let's say, the only relief they can get is from an anti-inflammatory. Well, then we tolerate it because quality of life is just as more important, I would say, than preserving kidney function in some cases. But those are rare cases. So in those situations, we just have to monitor the patients more closely because there's no doubt if you have kidney damage and you're on ibuprofen, the kidney damage is going to get worse a lot faster. So those patients need close monitoring. My personal thing is I try to avoid using non-steroidal anti-inflammatories in all of my patients. Now, for people who don't have kidney disease, I think they're a great option for pain control. But I only worry when people are taking them chronically. So if you need it for a couple of days because you have a gout attack or you injured yourself in a sports event or something of that nature, that's okay. But if you're on it for months and months and months at a time, then number one is you should have your kidney function checked regularly with a blood test and urine test, but also what's going on. See if there are other medications you can use because over time, the anti-inflammatories don't just cause kidney disease. They also cause fluid retention. They also cause high blood pressure. They cause ulcers in your stomach. So there are other reasons why I think we should try and avoid chronic or long-term use of the anti-inflammatories.
The group there that you mentioned, avoid completely being those with kidney disease. Would you lump, hypertensive patients who are on antihypertensive meds into that same group where you would generally recommend no anti-inflammatories at all or judiciously for that group?
Question. I mean, if you have high blood pressure, there is no doubt that the anti-inflammatories will increase the blood pressure a little bit. But if the blood pressure is beautifully controlled and they really need the anti-inflammatory, and even on it, the blood pressure still remains controlled, then I don't feel so strongly about it. So I think you have to look at it case by case.
Perfect.
If you have congestive heart failure and you're prone to getting fluid in your lungs, that's a case where I'm almost as strict as I am with my kidney disease patients, where I think the anti-inflammatories really can worsen fluid retention and promote worsening congestive heart failure.
I know in the last few years, kind of a lot of excitement in the world of nephrology in terms of meds that are protective for the kidneys that we didn't have in our armamentarium before. Can you talk a little bit about that? Who would be eligible for these meds? What do these meds do?
A lot of progress has been made in the management of diabetes in particular. The number one cause of kidney failure or kidney damage resulting in requiring dialysis or a transplant, the number one cause is diabetes. And for the last, up until a few years ago, we had gone decades without any advances in treatments. If you have diabetic kidney disease, number one is you should be on a blood pressure pill called an ACE inhibitor, which or an angiotensin receptor blocker, use them interchangeably. They can protect the kidney from function from deteriorating any further. In addition to that, we need to work on tight glycemic control and making sure the sugars are well controlled. That was almost all what we had for the longest time. And then recently, a class of drugs called sodium glucose cotransport inhibitors, which essentially promote salt and glucose excretion in the kidneys, in your urine. You pee out sugar and you pee out some salt. These medicines have been very helpful for controlling diabetes, but as a side effect, have also been shown to prevent heart failure, to protect the heart, and also to protect the kidneys. So if you have kidney damage from diabetes, you also ideally should be on one of those pills called a sodium glucose cotransport inhibitor, which has been revolutionary in terms of preventing progression of kidney disease. On top of that, we now have a new drug called an aldosterone antagonist called finerenone, which in patients who are still peeing protein in their urine because of damage from the diabetes, they also benefit from that drug. And again, just recently off the press, Ozempic has also been shown to protect the kidneys. And I think Ozempic has gotten a lot of press because of the benefits of weight loss. But there was a study called the FLOW study that showed, again, patients on Ozempic who had diabetic kidney disease had less progression. So we've gone from having one weapon to now 4 weapons for our patients with diabetic kidney disease. Now, not every patient needs all 4, but quite a few might. And so, again, this is going to require close conversations with your family docs to find out if you're a candidate for those medications.
Perfect. And speaking of medications, one thing I know comes up for us in terms of education for patients who are on certain meds, specifically blood pressure meds, so that when they get sick, that we recommend that they hold certain medications because of concerns about the effect on their kidneys. So if a patient's sick, if they're vomiting, they're having diarrhea, to hold certain meds. What's some advice that you give to patients around some of these meds?
And I know how complicated it is, and I try to make it simple. You know, there is a list of sick day drugs that we give our patients. Like if you develop nausea, vomiting, diarrhea, or any illness that makes you dehydrated, stop all of these meds. I even simplify it further. I tell my patients, listen, if you become severely dehydrated because you're unwell, stop all of your blood pressure meds. Just stop them. Let your blood pressure run high a bit. Stop all of your diuretics or water pills. Stop them all until you have recovered, and then resume them. I obviously, if they're type 1 diabetics, I make sure they continue to take their insulin, but just monitor their sugars more closely, because stopping the insulin in a type 1 diabetic would not be a good thing. But honestly, most meds can probably be stopped for a couple of days while you're recovering from an illness that's dehydrating you until you've recovered. But in terms of broad categories of drugs, you know, the ACE inhibitors, which are a type of blood pressure pill, or angiotensin receptor blocker, should be held if you're dehydrated. Any medicine that makes you pee out salt, we call them diuretics, should be held. If you're on anti-inflammatory drugs for any reason, they should be held. You know, so those are just a few of them. But honestly, my feeling is, listen, if you're that sick, stop all these meds, and then when you're feeling better, just resume them. Because no harm is going to happen from a transient rise in blood pressure while you're recovering from that illness.
Versus the effect on your kidneys. Yeah.
Yeah, exactly. On the contrary, if you stay on those medications, you can get severe kidney failure, and you might even need dialysis. So you really want to prevent that.
Perfect. We're going to take a quick break, and we'll be back right after this message. All right, welcome back. Again, we're being joined today by Dr. Faisal Rehman. He's a nephrologist at LHSC. Again, we're gonna change gears slightly. We have a bit of a fun conversation because in addition to being a nephrologist, Dr. Rehman has a bit of an interesting backstory in terms of interest and some expertise in combat sports. If you want to tell us a little bit about how you got into this.
Yeah, so back when I was 32 years old, I just bought a house that I couldn't afford. I was a new kidney doctor on the block, and I applied for life insurance. Around that time, I was also didn't have the healthiest lifestyle. I was eating too much, not exercising, and I ballooned in weight up to 242 pounds. And so when I got my life insurance test back, it said, we're not giving any life insurance. You have type 2 diabetes, high blood pressure, and high cholesterol, and you're too high risk. And I saw the blood work results, and it was shocking. It was shocking that I let myself go so much that I developed all these medical complications. And so I said, okay, I got to get myself in shape so I can have life insurance just in case something happens to protect my family. And I had young kids at the time. And so I used boxing and kickboxing to get back into shape. I lost about 90 pounds in 6 months, and my blood work normalized, and I was able to get coverage for my insurance, which was great. But then I kind of developed a love of combat sports. And so I started competing, raising money for charity through combat sports competitions, which was wonderful. And I started my own charity called Showdown in the Downtown that we're still operating today. And we've raised over $3 million to for medical research, to battle homelessness, to protect vulnerable populations, and to battle poverty. We have over 10 charities that now benefit from the money we raise. So very proud of that. And at the same time, I became involved with the Sports Commission of Ontario, and I became one of their physicians. And so when professional combat sports comes to Ontario, I'm often one of the ringside physicians supervising the competition. And I've had the immense pleasure to start taking care from an internal medicine perspective of some combat sports athletes. So I've seen a lot of complications as well of combat sports with respect to musculoskeletal injuries and concussions, as well as complications of, unfortunately, performance enhancing drugs. I've seen it all. And so we've been able to provide some help to those patients.
Yeah, what even prompted me to even bring that up is I was watching old highlights from UFC 129, and I see, is that Dr. Raymond at the ringside? So I know you've done a lot of the big events. One of the things I wanted to chat with you about today, and I think you have obviously a unique perspective on this, being a nephrologist with obviously an interest in combat sports, is the issue of weight cutting in combat sports. Obviously specifically MMA, which most of us, some of us follow more closely, and it's always kind of been a bit of a black box even to me as a physician, when they talk about having a protocol for how they're, bringing themselves down from a fairly significant weight loss within a short period of time, and then kind of ballooning up within a day or two. Can you talk to us a bit, just briefly, about kind of what that process is? Like, what kind of things do the athletes do in the days leading up to trying to meet a certain weight? What happens afterwards? And then briefly about kind of your feelings about this in terms of a safety perspective, what should be happening that maybe is not, and what kind of changes should be happening with these commissions.
Thank you very much. I think weight cutting is a big stain on combat sports, and it's an art and it's a science to some degree. But I think what most people agree on is it's not safe. And for some reason, in mixed martial arts, the weight cutting is much more dramatic than what we see in professional boxing. And what athletes will do is, often a few weeks before the fight, they'll often be 20, 25 pounds, sometimes more above their target weight. So they may be scheduled to fight at 170 pounds, but they're weighing 195 or 200 pounds. And then they begin their weight cut, which is not only dietary, but also is manipulation of fluids. Some of them will drink ultra pure distilled water, gallons of it a day. And that does induce the kidneys to pee a little bit more. And then they'll all of a sudden stop doing that a few days before the fight, but they keep peeing. So that kind of dehydrates them down. And on top of that, especially a few days before the fight, they'll spend additional time in the sauna, running, sweating it out. And so some of them come into the weigh-ins and they can barely walk. Okay. And then they get weighed, they make weight, hopefully, hopefully not. I don't know what the right answer there is. And then they all of a sudden rehydrate. And the way they rehydrate is often with IVs. In the UFC, they no longer allow that, but it still may be happening behind closed doors, where someone puts an IV in, they've got those, and they give 3 or 4 liters of normal saline intravenous fluids into them to help them recover, and then they go into the fight the next day. The reason I feel this is dangerous and why is that it makes you much more prone to brain injury. When you are adjusting your electrolytes very rapidly and you're changing the volume inside your blood vessels so rapidly, it changes the pressures in your brain. And it makes the blood vessels in your brain much more prone to bleeding. And so if you take a hard shot during competition, that can be enough to cause bleeding and swelling in the brain, even without bleeding, just swelling in the brain,
Mm.
and seizures and brain death. And so there's no doubt that there's a close association between weight cutting and brain injury. And so the way, we really have to try and develop new ways of dealing with that to try and really protect the fighters from themselves, because they will keep doing it. Everyone has this in their mind that if they can come into a fight way bigger than their opponent, um, they have an advantage. So even though maybe, for example, I should be fighting at 170 pounds, let's say, but I want to really beat up the small guy at 150 pounds. If I can dehydrate myself down to that weight, I feel I have an advantage. And we can't get rid of that feeling. And indeed, on fight day, sometimes it ends up being true. The bigger guy does often win or have a power advantage. So it's really a tough thing to try and explain to the fighters that that's not in their interest, especially when they're winning. But there's no doubt the risk of brain injury is much higher the higher the degree of the weight cut. And if possible, we should eliminate that.
And risk of renal injury as well?
Oh, absolutely.
Yeah.
So you're more prone to a complication called rhabdomyolysis, or breakdown of muscle, when you're a profoundly dehydrated state. Just from the dehydration itself, the blood supply to the kidney can be compromised. You can get kidney failure from that. So it's also damaging to the kidneys 100%.
And I know there's at least been a couple of fighters who've died of rhabdomyolysis from an aggressive weight cut, and it's quite unfortunate.
Absolutely.
You mentioned some kind of other kind of management of fighters from a kind of internal medicine perspective, and you've seen kind of some of the complications. And can you talk a bit about that? Obviously,
So yeah, so number one is, I'm lucky that I've surrounded myself by a good team, because I'm really an expert in internal medicine and nephrology, and these aspects of sports medicine I find interesting, but I often need help and advice. But fighters come to me because they trust me. I've been in the Ontario fight scene for a long time. I also provide care free of charge. Many other healthcare providers charge these fighters who have no money. They literally are paid peanuts for competing in this sport, and so I always do it free of charge for all of the fighters. I've done it for hundreds and hundreds of fighters in Ontario. And so some of the medical complications I've seen, number one, unfortunately, I've seen performance enhancing drugs related competitions. Athletes who are taking testosterone and other anabolic steroids, dealing with impotence, dealing with emotional difficulties, depression, anxiety related to performance enhancing drug use. And so I have colleagues in endocrinology and other fields who are experts in tapering off those medicines and using other medicines to try and compensate so that they can get off those medications. Concussions is another thing I see a lot of. And we have very good concussion teams run by our allied healthcare professionals, physiotherapists, occupational therapists, and others who help get those athletes back into a good state of health. So I'm kind of a conduit for the athletes to be able to access other experts so that they can get the proper care. Because unfortunately, our healthcare system doesn't allow that to happen. And many of our athletes don't have family doctors. And even if they do, because this is kind of outside of their expertise, sometimes there's money implications. And so I try to provide that free of charge. But yeah, the things I see the most are concussions, complications of anabolic steroid use, and with the weight cutting, it's unfortunately, if it's going to demonstrate itself, it's going to demonstrate with a patient getting knocked out in a competition, and then they're out of commission, and they need to be seen by a neurologist before competing again, for example. And then we see a lot of musculoskeletal injuries, like hand injuries, fractured hands, and such. And again, we have a great hand and upper limb clinic where I can refer these patients to.
Great. Well, again, thanks for joining us today. This was a fascinating conversation. Lots of great insights, especially around the kidneys. And I hope a lot of our patients take a lot of that information away and do their best to protect their kidneys moving forward. So again, thanks for joining us today, Dr. Rehman.
No, thanks so much for having me.
Again, thanks to Dr. Rehman for joining us today and for all of his helpful information about kidney disease. Again, a reminder, he mentioned the charity work that he does. So this October, so October 26th, at RBC Place in downtown London, there will be an event, showdown in the downtown, which is a combat sports event that Dr. Rehman is a part of that will raise money for charity. So we encourage you guys to look into that closer to the event. And until next time, stay healthy.